Hello, hello. My name is Sophie Nathanson of Widespread Wellness, and I'm here to talk to you today about medical sociology and population health. Let's get started. Medical sociology is my field. I was trained in that many years ago, and sociology, to start there, is the study of society. So it's really about the structure of a society. It differs from psychology, which really analyzes what makes one individual tick, and psychology studies differences between people, between individuals. But sociologists study differences between groups and between different societies. So medical sociology is really a sociological perspective on the health of a society and the healthcare system of society. So a medical sociologist will measure and study the health of an entire group of people and then kind of trace back what are aspects of the society that may be contributing to the health status of that group of people. Population health is a related term, and it refers to the health of a group. So, tying that to medical sociology, medical sociologists might study population health, as I do, and then, again, trying to figure out what are the root causes, what are the characteristics of a community that could influence the health of that group of people. This leads us to social determinants of health. Now, back to sociology and the sociological method, we're comparing groups, and so we are comparing groups based on social statuses and social factors. And so those are things like race, age, gender, sexuality, employment status, marital status, geographical location. And so we might compare some kind of health outcome, whether that be depression, anxiety, asthma, diabetes, COVID, and we're comparing the prevalences of illnesses such as those by different groups. Now, very importantly, this does not mean that people that share a social factor, people of the same race or the same gender, are all similar to each other. And if we would presume that, we would be stereotyping. Rather, when we compare different groups and look at some kind of health outcome, if there is a significant difference between those groups, that is really telling us that there might be something about that society that is contributing to that difference. So what does it say about a society where women are living a lot longer than men? And by the way, that is true in most societies. What about the example of mortality rates, that means death rates, differing by race, which certainly is the case. Also, when it comes to the social factor, for example, of socioeconomic status, which is a measure of your income, your occupation, your wealth, your education, all wrapped together. As people move up in socioeconomic status, their health tends to improve. And that means the higher socioeconomic status group has better health as a whole collectively than a group of people that is in a lower socioeconomic status. So these are place-based, they are achieved, things that you get over time, like number of years in education, or if you get married, but they're also ascribed, which means you are born with those characteristics. And we know that social determinants impact health. All of this is really tied in hopes of finding those underlying societal conditions to potentially change so that we could improve the health of that group. A lot of times this really boils down to the distribution of resources. I'm not talking about making people or trying to convince people to change their behavior necessarily. We're really looking at what are the drivers of illness in that society or in that group, and could we make modifications to that? So this is a paradigm shift, and it requires a paradigm shift from, for example, our healthcare system in the United States, which focuses on kind of a reductionistic model. There's a lot of experts, and so they're zeroing in on specific illnesses and diagnosing them and coming up with treatments, whether that's to try to eradicate that illness or just treat the symptoms. And so when we're talking about this more sociological / population health perspective, we're really trying to get to root causes, whether that's root causes in the environment or things that are affecting a single individual. More likely, we're looking at root causes in terms of aspects of the community, resources, and all of those types of factors. And this leads us to societal underlying conditions. If we can think back to the height of the pandemic, oftentimes you may have read in news articles talking about people that have passed away due to COVID, that there were underlying conditions involved. Things like diabetes, heart disease, those factors made people more at risk for hospitalizations and death due to COVID. So those underlying conditions, those chronic illnesses affect individuals. And at the country level, we also have huge problems with these chronic illnesses. These illnesses that people may have throughout their entire lifetime. And there are other factors such as our diet, our level of physical activity that contribute to and can exacerbate chronic illnesses. In addition to these chronic illnesses, we have another layer underlying that describes our petri dish, our culture, our infrastructure, the body parts of our society, the social institutions like our healthcare system, our educational system, our political system, religions, media, different industries, our transportation, our physical infrastructure, how our cities are laid out. And so if there are cracks in that foundation, if there are problems systemically with those building blocks of society, we know that those conditions can contribute to our collective well-being. So, as a review, there are social factors, those social statuses like race, gender, age, employment, housing, relationships, that can create more risk for people that have certain social factors. There are social institutions that can contribute to our collective, measurable well-being, both mentally, physically, and also emotionally, spiritually, socially, environmentally. These institutions are things like healthcare, education, religion, media, industries, and other systems. And so if we're comparing one society to another society, and there's a significant difference in, again, some kind of health outcome. It could be life expectancy. It could be the prevalence of certain mental health issues. Whatever the case, if there's a very big difference, then we might look at the characteristics of those societies. What makes them different? What set of social factors, what social institutions are both different conditions. And then we have public policy. And so if we're looking at these different levels, we have these social factors and group differences. Then we have the broader social institutions. And then at the city, state, and country level, we have laws, politics, or policies that can have a trickle-down effect on our lives and our collective health. And so looking at economic policies and social policies, really from a medical sociological perspective, economic and social policies are all health policies because they affect our health. And remember, our health isn't only a matter of our physical health and our mental well-being. It's also things like our access to services, the nature of the neighborhood we live in, how socially isolated or socially connected we are, whether we have a job, what the working conditions are like. All of those things are aspects of our health. So that is a brief overview of the field of medical sociology and population health as a concept and what that means as far as looking at root causes when analyzing and potentially improving our collective well-being. Here are some references for further reading, and thank you for listening. Hopefully you learned something and this may have piqued your interest